Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Izinkan saya melanjutkan video pembelajaran mata kuliah Keselamatan Pasien dan K3 dalam keperawatan. Topik pembahasan sesi ini adalah kerjasama tim dan keselamatan pasien. Materi pada sesi ini diambil dari tulisan Tanja Manser yang berjudul Teamwork and Patient Safety in Dynamic Domain of Healthcare dalam Akta Anestesiologika Scandinavian Journal.
Background. The process of providing healthcare is inherently interdisciplinary, requiring physicians, nurses, and allied health professionals from different specialties to work in teams. In the patient safety literature, it has been widely recognized that team performance is crucial to providing safe patient care. Poor coordination among providers at various levels of the organization appears to affect the quality and safety of patient care, e.g. delays in testing or treatment, conflicting information. Therefore, teamwork has become a focus of system-based interventions to improve patient safety and of medical education standards. Methods applied in studying the relationship between teamwork and patient safety. Methods used to study attitudes and perceptions, interviews, focus groups, and attitude surveys can provide useful diagnostic information relating to the perception of teamwork behavior. Over the past 10 years, a number of survey instruments have been adapted to and applied in healthcare. Some of these instruments that measure safety climate to diagnose the underlying safety culture include teamwork as one major aspect, whereas others specifically measure the perceived quality of teamwork. Methods used to describe and assess behavior. Although clinicians' attitudes and perceptions are very important aspects of teamwork, positive attitudes toward teamwork are not necessarily accompanied by appropriate behavior. Observation studies of patient care teams provide complementary information on effective team behavior such as coordination and leadership. Teamwork as an important contributing factor to adverse events. This review identified a number of empirical studies investigating the role of teamwork issues in the causation of adverse events in dynamic domains of healthcare. These studies fall into two main groups: retrospective analyses of incident and adverse event reports or malpractice claims, and observational studies. In summary, observational studies and retrospective analyses of incidents or adverse events indicate that any of the contributing factors originate from flawed teamwork rather than from a lack of clinical skills. Healthcare providers' perceptions of teamwork in dynamic medical domains. Surveys and interview studies regarding attitudes toward teamwork indicate that, consistent with many other high-risk industries, healthcare providers attribute a high degree of importance to teamwork aspects such as communication or coordination. In a qualitative study on the meanings attached to teamwork in the operating room, coordination, leadership, and its role in assuring patient safety and staff well-being were identified as the most prominent meanings. Healthcare providers' perceptions of teamwork in dynamic medical domains. Different groups of healthcare providers perceive the quality of teamwork differently. Staff's perceptions of teamwork are related to the quality and safety of patient care. Perceptions of teamwork and leadership style impact staff well-being. Different groups of healthcare providers perceive the quality of teamwork differently. Studies investigating clinicians' perceptions of teamwork found that the quality of leadership, the openness of communication, etc. were generally rated positively. However, most studies identified marked differences in the perceived quality of teamwork between professional groups, i.e. nurses reported lower levels of quality of teamwork than doctors. Within disciplines, i.e. trainee doctors reported lower levels of quality of teamwork than senior doctors. And between specialties, These differences in the way members of different professional groups perceive interpersonal interactions are also supported by a study investigating how different members of an operating room team perceive the same situation. Staff's perceptions of teamwork are related to the quality and safety of patient care. Little empirical evidence exists on the relationship between staff's perceptions of the quality of teamwork, or their attitudes toward teamwork, and the perceived or objectively measured quality and safety of patient care. For example, studies using clinicians' attitudes toward safety-relevant behaviors as indicators of safety found that although attitudes to these behaviors were generally positive, staff's responses also indicated a belief in personal invulnerability to stress and fatigue. This result was more pronounced in healthcare than in aviation. Perceptions of teamwork and leadership style impact staff well-being. Besides known contributors to staff well-being such as workload, time pressure, and job control, perceptions of teamwork and leadership behavior were found to be associated with employee outcomes such as emotional exhaustion, burnout, job satisfaction, and organizational commitment. For example, a survey of ICU nurses showed that leadership styles that seek and value contributions from staff promote a climate in which information is shared effectively, promote decision-making at the staff nurse level, and influence coordination of work to provide a milieu that increases nurses' intent to stay. Teamwork behaviors related to patient safety. Observational studies of teamwork have identified patterns of communication, coordination, and leadership that support effective teamwork. However, only a few studies could establish a direct link between specific teamwork behaviors and clinical performance or patient outcome. Teamwork behaviors related to patient safety. Communication patterns supporting effective teamwork. Coordination strategies supporting effective teamwork. Leadership behaviors supporting effective teamwork. Communication patterns supporting effective teamwork. Among the most prominent themes in communication research in healthcare are the effects of interruptions and tensions on effective team functioning. For example, ethnographic studies show that tensions in team communications in the operating room often evolve around the issues of time, safety and sterility, resources, and work roles. Another focus of communication research is concerned with the frames of reference that clinicians with different professional backgrounds refer to when discussing patient care decisions. Coordination strategies supporting effective teamwork. Coordination is essential to teamwork because different team members routinely perform multiple interdependent tasks simultaneously. Ethnographic research in anesthesia has highlighted that teams coordinate not only through verbal communication but also through their work environment, i.e. the precise alignment of team members' bodies, tools, and the patient's body. This coordination strategy, which requires an intimate knowledge of work roles and procedures, enables smooth team performance in most routine situations. These results are in line with human factors research in other high-risk industries, indicating that effective teams adapt their coordination strategies to the situational requirements, i.e. more implicit coordination during routine situations and more explicit coordination during critical situations. Leadership behaviors supporting effective teamwork. Leadership is a special means of coordination that has received considerable attention in research on trauma and cardiac arrest teams. These teams are prototypical examples of action teams because team members perform urgent and highly consequential tasks while simultaneously coping with frequent changes in team composition. In addition, these teams rarely communicate before attending to a cardiopulmonary arrest. Conclusion. This review of teamwork demonstrates the critical importance of teamwork in assuring patient safety in the dynamic domains of healthcare. Table 1 summarizes safety-relevant aspects of teamwork identified by the studies included in this review. Overview of aspects of teamwork relevant to the quality and safety of patient care and dynamical domains of healthcare.
Terima kasih atas perhatiannya. Bila perlu penjelasan lebih lanjut, silakan hubungi saya via email maupun WhatsApp. Saya tutup sesi ini dengan ucapan wassalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua.